1. A nurse is preparing to administer oral medications to a patient with dysphagia. What is the most appropriate action? A. Crush all medications and mix with pudding. B. Offer medications one at a time with thickened liquid. C. Place all pills in the back of the mouth together. D. Encourage the patient to self-administer all medications. Answer: B. Offer medications one at a time with thickened liquid. Rationale: patients with dysphagia have difficulty swallowing, so offering medications one at a time with thickened liquid promotes safe swallowing and reduces the risk of aspiration. A is incorrect because not all medications can be crushed, e.g., extended-release formulations. C is unsafe as it increases choking risk. D is inappropriate as the patient's condition requires nurse assistance. 2. Which action should the nurse prioritize when entering a patient's room who is on contact precautions for MRSA? A. Apply a surgical mask. B. Don a gown and gloves. C. Perform hand hygiene only after leaving the room. D. Use alcohol-based hand sanitizer before touching the patient. Answer: B. Don a gown and gloves. Rationale: contact precautions for MRSA require a gown and gloves to prevent transmission. A is incorrect as a mask is not required for contact precautions. C is incorrect because hand hygiene is needed before and after patient contact. D is insufficient alone as it does not address gown and glove requirements. 3. A nurse is checking the 6 rights of medication administration. Which right ensures the medication is given at the correct time? A. Right patient. B. Right route. C. Right time. D. Right documentation. Answer: C. Right time. Rationale: the right time ensures medications are administered according to the prescribed schedule. A verifies the patient's identity. B ensures the correct administration method. And D involves recording the administration, not timing. 4. A patient refuses a prescribed medication. What is the nurse's best response? A. Administer the medication anyway. B. Document the refusal and notify the provider. C. Convince the patient to take it. D. Skip the dose and do not document. Answer: B. Document the refusal and notify the provider. Rationale: respecting patient autonomy. The nurse should document the refusal and inform the provider for further action. A violates patient rights. C may undermine trust. D is unsafe and fails to communicate the issue. 5. A nurse is teaching a patient about a low-sodium diet. Which statement indicates understanding? A. I can eat canned soups daily. B. I'll choose fresh vegetables over processed foods. C. I'll add table salt to enhance flavor. D. Pickles are a good low-sodium snack. Answer: B. I'll choose fresh vegetables over processed foods. Rationale: fresh vegetables are naturally low in sodium, unlike processed foods. A is incorrect as canned soups are high in sodium. C and D are incorrect as table salt and pickles increase sodium intake. 6. A nurse is assisting a patient with ambulation after surgery. Which action promotes safety? A. Allow the patient to walk independently. B. Use a gait belt and provide support. C. Encourage rapid walking to build strength. D. Position the nurse behind the patient without contact. Answer: B. Use a gait belt and provide support. Rationale: a gait belt ensures patient stability and prevents falls. A is unsafe post-surgery. C risks overexertion. D fails to provide necessary support. 7. When delegating a task to a certified nursing assistant, CNA, which task is appropriate? A. Administering oral medications. B. Taking a patient's vital signs. C. Developing a care plan. D. Interpreting lab results. Answer: B. Taking a patient's vital signs. Rationale: CNAs can perform tasks like taking vital signs within their scope. A, C, and D require nursing judgment and are outside a CNA's role. 8. A nurse observes a patient with a history of falls attempting to get out of bed unassisted. What is the priority action? A. Raise all side rails. B. Apply a bed alarm. C. Restrain the patient. D. Allow the patient to ambulate alone. Answer: B. Apply a bed alarm. Rationale: a bed alarm alerts staff to prevent falls without restricting movement. A may trap the patient, increasing injury risk. C is a last resort and unethical without justification. D is unsafe given the fall history. 9. A nurse is performing a physical assessment. Which technique is used to assess for bowel sounds? A. Palpation. B. Auscultation. C. Percussion. D. Inspection. Answer: B. Auscultation. Rationale: auscultation with a stethoscope is used to listen for bowel sounds. A. Assesses tissue texture. C. Evaluates density. And D. Involves visual observation. 10. A patient asks, "Why do I need to wash my hands before eating?" What is the nurse's best response? A. It's a hospital rule. B. Hand washing reduces the risk of infection. C. It makes your hands smell better. D. It's only necessary if your hands are visibly dirty. Answer: B. Hand washing reduces the risk of infection. Rationale: hand washing removes pathogens, preventing infections. A is dismissive. C is irrelevant. And D is incorrect, as hands can carry microbes without visible dirt. 11. A nurse is documenting care in the patient's chart. Which entry is most accurate? A. Patient seems fine. B. Patient reports pain at August 10th, relieved by medication. C. Patient is non-compliant. D. Patient looks anxious. Answer: B. Patient reports pain at August 10th, relieved by medication. Rationale: documentation should be objective and specific. A and D are subjective, and C is judgmental without evidence. 12. A nurse is caring for a patient with a fever. Which intervention is most appropriate? A. Apply a heating pad. B. Administer an antipyretic as ordered. C. Restrict fluid intake. D. Cover the patient with heavy blankets. Answer: B. Administer an antipyretic as ordered. Rationale: antipyretics reduce fever safely. A and D may increase body temperature, and C can lead to dehydration. 13. A nurse is prioritizing care for multiple patients. Which patient should be seen first? A. A patient requesting a glass of water. B. A patient with a blood pressure of 90/60th millimeter of mercury. C. A patient awaiting discharge instructions. D. A patient needing a dressing change. Answer: B. A patient with a blood pressure of 90/60 mmHg. Rationale: hypotension is a critical finding requiring immediate assessment. A, C, and D are less urgent. 14. A nurse is providing culturally competent care to a patient who speaks limited English. What is the best approach? A. Use hand gestures only. B. Speak loudly in English. C. Use a certified medical interpreter. D. Ask a family member to translate. Answer: C. Use a certified medical interpreter. Rationale: a certified interpreter ensures accurate communication. A and B may lead to misunderstandings, and D risks errors as family may not be trained. 15. A nurse is preparing a sterile field. Which action maintains sterility? A. Touching the field with bare hands. B. Placing sterile items within the 1-inch border. C. Using sterile gloves to handle items. D. Opening sterile packages away from the field. Answer: C. Using sterile gloves to handle items. Rationale: sterile gloves maintain the field's sterility. A contaminates the field. B treats the border as non-sterile. And D risks contamination if not done carefully. 16. A patient is on bed rest. Which intervention prevents pressure ulcers? A. Reposition the patient every 4 hours. B. Use a donut-shaped cushion. C. Reposition the patient every 2 hours. D. Apply lotion only to dry areas. Answer: C. Reposition the patient every 2 hours. Rationale: repositioning every 2 hours relieves pressure and promotes circulation. A is insufficient, B may increase pressure, and D does not address pressure relief. 17. A nurse is assessing a patient's pain level. Which question promotes accurate reporting? A. Your pain isn't that bad, is it? B. Can you rate your pain on a scale of 0 to 10? C. You don't need pain medication, do you? D. Is your pain tolerable? Answer: B. Can you rate your pain on a scale of 0 to 10? Rationale: a standardized scale ensures objective pain assessment. A, C, and D are leading or subjective. 18. A nurse is performing hand hygiene. Which step is critical before patient contact? A. Use soap and water for 10 seconds. B. Dry hands with a cloth towel. C. Rub hands with alcohol-based sanitizer for 20 seconds. D. Rinse hands under cold water. Answer: C. Rub hands with alcohol-based sanitizer for 20 seconds. Rationale: alcohol-based sanitizer for 20 seconds effectively kills pathogens. A is too short, B risks contamination, and D is ineffective without soap. 19. A nurse is teaching a patient about fall prevention at home. Which recommendation is most effective? A. Keep floors cluttered for easy access. B. Install grab bars in the bathroom. C. Use throw rugs for comfort. D. Dim lighting to reduce glare. Answer: B. Install grab bars in the bathroom. Rationale: grab bars provide stability and prevent falls. A, C, and D increase fall risks. 20. A nurse is responding to a code blue. What is the priority action? A. Administer oxygen. B. Begin chest compressions. C. Call for additional help. D. Check the patient's chart. Answer: B. Begin chest compressions. Rationale: in a code blue, chest compressions restore circulation in cardiac arrest. A and C are secondary, and D is irrelevant during an emergency. 21. A nurse is preparing to transfer a patient from bed to a wheelchair. Which action ensures safety? A. Lock the wheelchair wheels. B. Raise the bed to its highest position. C. Transfer without assistance. D. Position the wheelchair at a 90-degree angle. Answer: lock the wheelchair wheels. Rationale: locking the wheels prevents movement and ensures safety. B increases fall risk. C is unsafe. And D is incorrect, as a 45-degree angle is preferred. 22. A patient reports nausea after eating. What is the nurse's first action? A. Administer an antiemetic immediately. B. Assess the patient's symptoms and history. C. Encourage the patient to eat more. D. Document the nausea without intervention. Answer: B. Assess the patient's symptoms and history. Rationale: assessment identifies the cause and guides intervention. A is premature. C may worsen nausea. And D neglects patient care. 23. A nurse is providing oral care for an unconscious patient. Which position prevents aspiration? A. Supine. B. Prone. C. Lateral. D. Trendelenburg. Answer: C. Lateral. Rationale: the lateral position allows secretions to drain, reducing aspiration risk. A, B, and D increase aspiration risk. 24. A nurse is teaching a patient about wound care. Which statement indicates understanding? A. I'll clean the wound with alcohol daily. B. I'll change the dressing when it's soiled. C. I'll leave the wound open to air. D. I'll reuse the same dressing to save supplies. Answer: B. I'll change the dressing when it's soiled. Rationale: Changing a soiled dressing prevents infection. A may damage tissue. C. Risks contamination. And D. Is unhygienic. 25. A nurse is caring for a patient with a urinary catheter. Which action prevents infection? A. Empty the drainage bag once daily. B. Secure the catheter to the leg. C. Use sterile gloves for routine care. D. Disconnect the catheter to check output. Answer. B. Secure the catheter to the leg. Rationale. Securing the catheter prevents movement and reduces infection risk. A is too infrequent. C is unnecessary for routine care. And D risks contamination. 26. A nurse is assessing a patient's respiratory rate. What is the normal range for an adult at rest? A. 8 to 12 breaths/min. B. 12 to 20 breaths/min. C. 20 to 28 breaths/min. D. 28 to 36 breaths/min. Answer. B. 12 to 20 breaths/min. Rationale. The normal respiratory rate for adults is 12 to 20 breaths/min. A, C, and D are outside this range. 27. A nurse is preparing to administer an intramuscular injection. Which site is most appropriate for an adult? A. Deltoid. B. Vastus lateralis. C. Rectus femoris. D. Dorsogluteal. Answer. B. Vastus lateralis. Rationale. The vastus lateralis is preferred for its large muscle mass and safety. A is smaller, C is less commonly used, and D risks sciatic nerve injury. 28. A nurse is caring for a patient with a nasogastric tube. Which action ensures proper placement? A. Check tube length daily. B. Verify placement with an X-ray. C. Aspirate gastric contents only. D. Inject air and listen for gurgling. Answer. B. Verify placement with an X-ray. Rationale. An X-ray confirms nasogastric tube placement. A, C, and D are unreliable or outdated methods. 29. A nurse is teaching a patient about deep breathing exercises. What is the primary purpose? A. Improve digestion. B. Enhance oxygenation. C. Reduce blood pressure. D. Promote weight loss. Answer. B. Enhance oxygenation. Rationale. Deep breathing increases oxygen delivery to tissues. A, C, and D are not primary outcomes. 30. A nurse is caring for a patient with a hearing impairment. Which action facilitates communication? A. Speak loudly in the patient's ear. B. Use written communication. C. Face away from the patient while speaking. D. Use medical jargon to explain care. Answer. B. Use written communication. Rationale. Written communication ensures clarity for hearing-impaired patients. A may distort sound. C. Prevents lip reading. And D. Is confusing. 31. A nurse is preparing to administer eye drops. What is the correct technique? A. Drop medication into the conjunctival sac. B. Apply drops directly to the cornea. C. Have the patient look down during administration. D. Rub the eye gently after administration. Answer. Drop medication into the conjunctival sac. Rationale. The conjunctival sac is the safest site for eye drops. B. Risks corneal damage. C. Hinders access. And D. May cause irritation. 32. A nurse is caring for a patient on oxygen therapy. Which action ensures safety? A. Place a no-smoking sign near the patient. B. Use petroleum-based lubricant for nasal dryness. C. Store oxygen tanks on their side. D. Disconnect oxygen during meals. Answer. A. Place a no-smoking sign near the patient. Rationale. Oxygen is flammable, so a no-smoking sign prevents fire hazards. B is unsafe as petroleum is flammable. C risks tank damage. And D interrupts therapy. 33. A nurse is teaching a patient about a high-fiber diet. Which food is the best choice? A. White rice. B. Whole grain bread. C. Ice cream. D. Processed cheese. Answer: B. Whole grain bread. Rationale: whole grain bread is high in fiber. A, C, and D are low-fiber options. 34. A nurse is assessing a patient's skin integrity. Which finding indicates a stage 1 pressure ulcer? A. Non-blanchable redness. B. Full-thickness skin loss. C. Blister formation. D. Exposed muscle tissue. Answer: A. Non-blanchable redness. Rationale: stage 1 pressure ulcers present as non-blanchable redness. B, C, and D indicate more advanced stages. 35. A nurse is preparing to insert a urinary catheter. Which action maintains sterility? A. Use clean gloves to prepare the patient. B. Lubricate the catheter with sterile lubricant. C. Cleanse the meatus with alcohol. D. Open the sterile kit away from the patient. Answer: B. Lubricate the catheter with sterile lubricant. Rationale: sterile lubricant maintains the sterile field. A and C risk contamination, and D is unnecessary if the kit is opened carefully. 36. A nurse is caring for a patient with a new colostomy. Which teaching point is most important? A. Change the pouch every 24 hours. B. Monitor the stoma for pink, moist appearance. C. Avoid all high-fiber foods. D. Reuse the pouch to save supplies. Answer: B. Monitor the stoma for pink, moist appearance. Rationale: a pink, moist stoma indicates health. A is excessive, C is unnecessary, and D is unhygienic. 37. A nurse is responding to a fire alarm in the hospital. What is the priority action? A. Evacuate all patients immediately. B. Use the fire extinguisher. C. Follow the race protocol. D. Return to normal duties. Answer: C. Follow the race protocol. Rationale: the race protocol, rescue, alarm, contain, extinguish/evacuate, ensures systematic response. A may be chaotic, B is premature, and D is unsafe. 38. A nurse is caring for a patient with diabetes. Which vital sign is most critical to monitor? A. Temperature. B. Blood pressure. C. Blood glucose. D. Respiratory rate. Answer: C. Blood glucose. Rationale: blood glucose is critical for diabetes management. A, B, and D are important, but less specific to diabetes. 39. A nurse is teaching a patient about proper body mechanics. Which statement indicates understanding? A. I'll bend at my waist to lift heavy objects. I'll keep objects close to my body when lifting. C. I'll twist my torso while lifting. I'll lift with my arms only. Answer: B. I'll keep objects close to my body when lifting. Rationale: keeping objects close reduces strain. A, C, and D increase injury risk. 40. A nurse is caring for a patient with limited mobility. Which intervention promotes comfort? A. Position the patient in a supine position all day. B. Use pillows to support proper alignment. C. Avoid range of motion exercises. D. Keep the bed flat at all times. Answer: B. Use pillows to support proper alignment. Rationale: pillows maintain alignment and reduce pressure. A, C, and D may cause discomfort or complications.